Welcome to the Busted Fighters Repaired Daily podcast. On Busted Fighters, we discuss sports medicine topics important to MMA athletes, their doctors, therapists, trainers, and coaches. Our guests tell their story of recovery from a specific injury, what worked for them, what didn't, and why. I'm your host, Matt Colby. I'm a chiropractic sports physician, and I focus on the problems MMA athletes run into during training, fight camps, and competition. Today, I'm here with my friends Tom Allman, Matt Andrade, and our very special guest, Augusto Mendes, Tanquinho. He's my jiu-jitsu professor. He has been for 8 or 9 years. And when Tanquinho's on a podcast, usually the focus is on his unbelievable career in jiu-jitsu and MMA. Today, our topic was his cervical disc herniation. He had an acute cervical disc herniation, a fusion, complications after surgery, and he was told it was going to be impossible for him to return to the sport. Guess what? That's not what happened. Afterwards, he came back and won ADCC. He was in the UFC, and he's still competing today. So here it is, an entire episode regarding how to ruin and repair your neck in MMA or jiu-jitsu with Augusto Tanquinho Mendes. Thank you for being here, Professor. I really appreciate it.
Thanks, man.
Yeah. So
pleasure.
Yeah. So we met 7 or 8 years ago.
Yeah.
I didn't know who you were. I knew very little about jiu-jitsu. I had taken like 2 or 3 classes. And from then till now, so much has happened. Yes. I mean, you've won ADCC, you've been in the UFC, you're now doing ACB where you can do MMA and grappling matches. Is that right?
Yeah. Yes.
Yeah. So on this podcast, we talk a lot about sports injuries, right? And when I was putting this together, I've really been thinking about doing a sports medicine podcast for a couple years. And this is the episode I was always really excited about because we have a very important topic, right? How to ruin your neck in MMA and wrestling. And we have a very important guest, and you have a really amazing story when it comes to lower cervical spine injuries, surgery, rehab, rolling and fighting with and without injuries. Tell us a little bit about it. I know it's a long story, so just pick it up wherever you'd like to.
Yeah. Well, for me, like I was living in Brazil, right? Mm-hmm. And somehow I hurt my neck there training. I don't know if I had something before or I never felt nothing. Mm-hmm. I was already a black belt and competing like internationally, all that high level competition. And like one day training, I just felt something wrong on my neck, and next day my neck was super stiff. I couldn't move, and then it just got worse as the days was passing by, and like in 10 days I need to do the surgery. Like that was the time frame. Like the day that I got hurt.
From when you first got hurt.
Exactly. Yeah. And then until I do the surgery, it was like 10 days apart. So it was just getting worse. I went to the neurosurgeon in Brazil. We did MRI, and he told me, man, we need to go to surgery right now, I had a big compression on the spinal cord. And he pretty much told him that I would not be able to train anymore, to competing or nothing. He said, with luck, we're going to be able to teach, show the moves, but like competing on the high level, the way that you do it now, it's going to be impossible.
Not a very optimistic prognosis.
It is, yeah. Well, but like, I understand doctors, most of the time, they want to tell you that you're not going to,
right?
Do things like that.
Now, was your particular neurosurgeon, was he or she familiar with like the nuances of the sport?
Well, he told him that he was, but I think he was not.
Right.
I think he just, I know what jiu-jitsu,
I think when a lot of jiu-jitsu or grappling patients find themselves speaking with their doctor, they have to kind of fill them in on what all you're doing, right? That's right. I think lots of times with neck injuries, they're picturing, I think sometimes the athlete is picturing that they're sustaining these neck injuries from getting choked or from getting neck cranked. But the real mechanism of injury for a hurt disc in the lower cervical spine is usually compression, like axial compression, like weight on the top of the head or weight to the forehead.
That's, I think, what happened to me, because years, like I used to post my head on the ground, like to avoid like sweeps or takedowns, or just hitting my head constantly on the ground through the years, and eventually probably that's how I got like a hernia and they need to do the fusion.
Now, before the day you hurt your neck felt fine or close to fine?
No, fine. I never had nothing. I never felt nothing. Like normal like injuries here and there, but like sore here, but nothing the way that I was feeling.
Yeah.
I started like, my chest, my biceps, triceps, my whole right side was start to atrophy. I was losing, like I said, on those 10 days, I lost pretty much, let's say like 14 pounds just on that side. It was a atrophy, everything, and I was super scared too. I didn't know what it was going to happen.
That was right as soon as you came to the U.S., right? Like you had surgery, you came to the U.S. a week or two later, and you're having these complications from the surgery.
Yeah, well, like I had the trip already scheduled. I was coming to United States. I'm moving here in December, and that's happening. I think it's in November, if I'm not wrong. And then, like I said, in 10 days, I did the surgery. I did the first 2 weeks of rehabilitation in Brazil, and then I just moved it. That made me even more scared because I didn't know like what's going to happen here. And I was thankful to meet you, you know what I mean? And back in the time, I think it was first week or maybe second week, I don't remember exactly. And then you started the treatment with me, and pretty much I did everything here with you, like getting back there, getting the muscles back, taking care of the neck again.
Yeah, and just to catch everybody up to speed, right? So Tanquinho apparently had an acute disc herniation. A lot of disc herniations with wrestlers and grapplers are chronic, meaning like you had a problem that finally got to the point where your disc broke. It sounds like for you it probably was an acute herniation versus chronic. And who knows if you had something going on ahead of time, but with driving with your head and posting on your head and things like that, it could have been the situation where eventually, it took a certain amount of damage and that disc broke. Now, the surgery that Tanquinho had was a C5, C6 fusion, which is really common among wrestlers and fighters. I know at least 7 or 8 grapplers and wrestlers and MMA fighters who have had fusions. And, of course, it's something you want to avoid, but in his case, he needed surgery. Like, things were very painful and going very wrong. He probably had a huge disc herniation in there. Yeah. And when they did the surgery, what Tanquinho was talking about regarding his arm getting weak and losing weight, and that's called a C5 palsy. And it does happen fairly frequently with fusions. And I took a little bit of a look this morning before the podcast, and depending on the source, they say it happens somewhere between 3.5% to 4.5% of the time when someone has a fusion, and that's specifically for the segment that you had at C5, C6.
So they're basically welding it together?
Basically, what they did is he had a disc explode, right, herniate at C5. So the disc had to go because the disc is pinching the nerve, right, the C5 nerve. And so they remove the disc. They do a discectomy, right? They take the disc out, and then they do a fusion. So they took vertebrae number 5, C5, and vertebrae number 6, and they made them one.
So you're shorter afterwards?
Maybe slightly. Well, they're taking a very small disc out and usually put bone grafting in. Shit. So
that's why I'm short. No, people see.
You were tall before.
I was tall, yeah.
But one other interesting thing about the complications that he had afterwards is that it was a C5 palsy, and that was the C5 segment that was fused, and that's where this complication after surgery happens 3 or 4% of the time.
So the arm was dead? Or?
Not dead, but like I lost pretty much all the muscles here, like just atrophied the muscles. So I couldn't even do a push-up, like right after that. And
it's like your pec was like, for lack of a better word, it looked deflated. Like there's a pec muscle here,
you could see like
a flat one.
Yeah,
like both of them.
Yeah, you couldn't see the difference. Like when it was like no shirt, you see like, oh man, one side is good, the other one is not.
Yeah, the lateral pectoral nerve branching out from C5 is where this happens the most. And most people do get better. Like this can happen right after surgery or up to 20 days after where this problem occurs. And most of the time it does get better on its own. We worked on it, when he came in the clinic, and we were doing some things to help, help it come back faster. But there really is no way to tell if some of the things we did, like soft tissue therapy, a little bit of traction, laser therapy, if those things helped, or if they were just supportive, or if they didn't really do anything and he just got better on his own. It's hard to tell, but very scary, like when you have a surgery like that to fix something and you come out with a new problem.
Exactly. And like for me, I didn't know if he was getting the muscles back or not. Like I said, in my mind, it was just which the doctor told me I will not train anymore. I was just trying to get the muscles back and have a normal life. You know what I mean? Like,
So it's kind of like choking off the hose to that area where you're not even push-ups weren't helping. It's just deflating.
Yeah,
That's crazy.
You're pinching the nerve.
Yeah.
And the reason it happens a lot with C5 is C5, that nerve is where the peak of your lordotic curve is, the curve that's in your neck. And when they do the surgery, not because a mistake was made or anything, that nerve can get pulled on and tethered and tractioned back, and either it gets damaged permanently or damaged temporarily.
that's
what
why the
happened here.
doctor told me I need to do the surgery right away, because he told me it was like big compression and was making damage on the nerve. So if I keep that compression longer, might be like forever. You know what I mean? So he said, well, let's do just the surgery, head to the hospital, do it right now, and that way, like, with time, the damage is gonna heal, and then you're gonna get back the muscles back. Which time? No, I think for me it took about like probably 6 months to start to get everything back, and then for sure I didn't have any pain right after the surgery.
Sounds frustrating.
Yeah, that was. Well, it was a hard time. You know what I mean? And imagine like moving from Brazil to here. You know what I mean? Not speaking the language. You know, so it was a really hard time.
When did you get back to training? How long after surgery did you actually start to do
Train,
things
yeah.
on the mat again?
Well, like I did a lot of exams first to get the authorization for the doctor, because I didn't want to step his toes and say, hey, okay, I'm gonna do it. I'm tough. No, I said, well, like, I don't know, it's my neck. If something goes wrong, like, I might be paralyzed forever, no? So I said, well, like, so he sent me to do new exams here. I did the MRI again. I did another one that I don't remember the name, that kind of tell you about the nerve a little bit, like
like a spark test?
Yes, yeah.
So it's called a nerve conduction velocity test, NCV, or EMG, electromyogram. And what they're doing is they're sending a shock, like a spark, kind of like when you touch a doorknob and it sparks you, up the nerve, and they're measuring the speed that spark travels.
Yeah.
Just like electricity, just to see if there's a connection or if there's something cut in the middle.
Yeah.
And it is considered like the gold standard to prove that a nerve is being pinched. But usually when you're getting this test done, you already know if a nerve is getting pinched because it's not working right? The question is, where is it getting pinched? And that test is known to vary a lot depending on who's administering the test, and it can vary from day to day on people. But it is considered the standard for proving that nerve's getting bumped into. Usually before surgery.
So
Usually
it's not
they do
idiot proof with a dipshit doctor that doesn't know.
Right.
He's,
Well, it's a little bit subjective.
Right.
So, but it's good to do. People do it a lot before surgery to prove that the symptoms are coming from the problem that they see. So,
Yeah. So I did that too, and he later let me start back to train light. You know what I mean? Choosing my trains, not posting my head on the ground for a while. You know what I mean? That was really conservative, like choosing who I was training. So, but I think I started training. So I had the surgery in November. I think it was May. So that was about like 6 months. Yeah. So that's when I started training light again. And that was May. In August, I fought my first tournament back. That was the Las Vegas Open, and I won my division too. I was like I said, I started training in May. Probably in June or July, I started training really hard again, like high intensity. And then I just was missing too much the competition. That I said, oh, I'm gonna sign up and compete and see what's gonna happen. And then won, so I was like, okay, cool, that's great.
Did you find yourself favoring it at all?
like, do you roll differently now? I think this is
Back in
something
the
you probably
time,
don't.
I did.
Yeah.
Not now.
Yeah.
Now, like I just forget about.
good,
And
yeah.
but like back in the time, it was super like, oh,
You
nobody
gotta
can touch
build
my
confidence.
neck. Exactly. Nobody touch my neck. You know what I mean? If someone was on my back, I was okay, tapping, start over again. And I never had that ego. You know what I mean? To be like, oh, I'm the tough one, especially in training. Like, I like training harder, but I need to understand limitation. You know what I mean?
Right.
And back at the time, I had some limitation. And that was not my first surgery, too. The fusion was not the first. I had, like, a elbow surgery, too, that took me out for 6-7 months, too. Before that, like 1-2 years before. So when I came back, it was almost in the same situation. I didn't want to post my hand on the ground, or I don't want someone to attack my arm. So I just changed my game to defend him on my arm. And they started to do the same thing with my neck,
One thing you brought up was posting on your head, right?
Yeah.
Now, when we have wrestlers and jiu-jitsu people and MMA fighters, present to the clinic with neck problems, especially if they have radiating pain, Now this is where the athlete really has to start considering the amount of time they post on their head. Some people post on their head a lot and some don't. Yeah. People who shoot in for single and double legs a lot and get stuffed, that's not great for the discs in your neck too. And it's not to say that these things are going to cause problems with your neck, but once the athlete has identified that they have a problem, now this is something worth avoiding. Like you had to avoid that after surgery in your situation, but there's plenty of athletes that we meet who are having ongoing neck issues, but they don't sort of revise their game, right?
But that's the thing, like I changed that a lot. Like when I heard I had the surgery, through the years, I started to protect my neck way more. And like shooting to single leg or double leg, that's something that I avoid like almost 100%. I pretty much don't shoot anymore. But during my preparation for ADCC last year, 2019, in September, was a no-geek tournament, so there's a lot of wrestling there on the ADCC rules. So I was doing way more like shooting. And then a week before the tournament, I did a big shooting in Kyler Phillips, and I hit my head, the top of my head, on his hips, and I felt right away going to my arm again, and I was like, oh, I can't believe it. No,
when you did that, did you hear a bunch of crackling like in your neck?
No, I couldn't hear nothing. No, I mean, it was too fast too. I just felt.
Gotcha.
And then I felt a little bit sore, but nothing too bad. So I just rest. It was already like 1 week to the tournament. I said, okay, I'm gonna rest, try to recover that. And then I went there, I fought again. I didn't feel nothing during the fights. I won the tournament. And then I took like 1-2 weeks off, and then I got an MMA fight. So I just started camp again. It's my first week training. I felt again my neck.
Down the arm.
Exactly. Doing MMA, I just shooting someone on the cage, going to single leg, double leg, and then I felt my neck again. I said, well, I'm stopped. And then I went to you again. We did the whole rehabilitation. And I just pulled it out of the fight.
I did some traction, I think.
Exactly. I did traction. I did massage, a lot of massage.
Yep.
The muscle of my back all kind of like holding everything. And
muscle guarding.
But that make me like kind of remember that, like, wow, that's why I'm not shooting, for years.
The only other mechanism of injury you can think of offhand, like we talked about shooting, talked about posting on the head, is especially in jiu-jitsu, is inverted guard, right? Yeah. Because a lot of people can do inverted guard all day, and sometimes, especially bigger people, can't even get there. And one way people hurt their necks a lot and have disc bulge, disc herniation, and disc protrusion. I should say disc protrusion because that covers everything. Disc protrusion issues later is they either get smashed, right, and both legs up over their shoulders, and wrestlers get smashed too, or they're playing a lot of inverted guard. And the theory there is that when you're in an inverted, you're stretching out the posterior longitudinal ligament that holds your discs in. So if you get smashed and hurt that ligament, lots of times people, their neck hurts and they're fine, but they start having disc symptoms like a month later or later than that. Or if someone plays a lot of inverted guard, a lot of people really like that. Slowly over time, they're stretching out that posterior longitudinal ligament and causing damage to the thing that holds the discs in.
So when Maverick and Goose were inverted, that's
different kind of inverted. Different kind of inverted.
Now you're saying that makes sense for me because I since I started jiu-jitsu to the brown belt in my first year as a black belt, I was pretty much a guard player. So I was pulling guard and playing bottom. And since I hurt my neck, I just started to develop my top game. And now I am way more top player than a guard player, So I just more on top and probably might be because of that, you know what I mean? I didn't want to be on bottom and people like stack me and crush my neck again. I said, well, just be on top and that's it.
Yeah. And for people, if you do get stacked, especially if you're a less flexible player, when you get stacked, you automatically turn your head to the side a bit. That gives you some room. If you get stacked quickly, like in a tournament, and you keep your head straight, that's where
even in training. Sometimes it's hard to control the pace of someone, and they just go too fast, and that's happening.
Yep. So we've talked about like how these injuries happen and the things that when you start having a neck problem you need to avoid. Let's try to get into like what we can do that's proactive. Like in your case, you had that disc splatter all at once, and there wasn't a whole lot to do. But with a chronic problem, some of the things that we did for rehab are things that can be done on the front end. And for some people, hopefully to avoid surgery, to avoid these things getting worse, because a lot of the disc issues in wrestlers and grapplers are a chronic, slow-moving thing that came on over time. And one thing that people recognize a lot more today is the use of traction, or as I like to say, spinal decompression, right? Because people get these disc issues and disc protrusions that lots of times they heal on their own, but lots of times with decompression or traction with the low back or the neck, basically we're pulling someone apart like an accordion and inviting that disc to pull itself back in. And
blood flow and all that too.
Yeah, a little bit. But basically what you're doing is you're creating a negative pressure, like a vacuum situation in the disc. So now that splattered nucleus can start to come back in, hopefully, right? And sometimes it works amazingly. Sometimes it can flare things up. So when someone has an acute disc issue, we have to think about, we go into everything with a bit of caution, right? Because chiropractic manipulation or spinal manipulation of the neck has been shown to help herniated discs.
But that's not real, right? I mean,
right? Yeah, it's all fake research. That's something we'll get into because actually, that's one of the things that I call the big five, the top 5 lies people say about chiropractic physicians or chiropractic and stuff. So we're going to get into that on actually a special episode. But so spinal manipulation has been known to help. Decompression therapy, fancy form of traction therapy, has been known to help. And then, of course, exercises, stabilization exercises and things like that. One study I actually saw this morning while I was kind of like taking a shallow dive into this topic is that let me grab this real quick. In the Journal of Orthopedic and Sports Physical Therapy, there's a study that shows that they had really positive results with thoracic spine manipulation. So like a chiropractic adjustment of the thoracic spine, staying away from the neck, and doing traction on the neck. Doing those things two together
at the same time?
Well, like they'd manipulate the thoracic spine, then do some traction on the neck. Because the thought is if you have a really flared up disc and you start doing what people would traditionally think with neck manipulation, which is turning the head, rotation could definitely irritate it.
Right.
But it could definitely help on another person. So what we usually like to try to do is I'll do thoracic spine manipulation, shoulder, no sweat, just try to loosen everything up and buy you some slack. And then we'll do some manual traction, meaning don't go decompression the first day. I'll do traction with my hands and a little bit of joint manipulation front to back,
so it's
but
like
not rotating the head.
Internal yoga almost.
Yeah, maybe. And then doing, if that goes well, then the next day doing a little bit of decompression. See if that goes well and easing your way into it. But with a problem like that, like inflammation is a key factor because some people will do great, and the more interventions we do, the better they do. And then some people are so ripe you can't even do anything. You can't even massage their neck. So there are things that you can do, but one thing that has really seemed to help wrestlers is a little bit of daily traction, right? Because if you're having a neck issue, sure you can come into a clinic 2, 3, 4 times a week and get 20 minutes of traction, but isn't it better to do 10, 15 minutes a day? On your own. So there's actually these home traction units now. You were doing one for a little while, right?
Yeah, you told me about like to buy that on Amazon. The one you put in the door.
Yeah.
That thing helped me, and I don't do shit. So
No, like I felt way better through the years. All right, when you got done with the whole therapy, he told me like, wow, that's something that you need to do forever. Like keep doing traction. You know what I mean? Just to keep like the space between the vertebrae and not because when you have the fusion, that's what the doctor told me. And Dr. Matt told me too, like you create a lot of more pressure on the above vertebra and the below vertebra. So the chance you to have that again is higher. So you need to keep doing that therapy with time and the traction just to avoid that in the future,
Yeah, and even if you sleep wrong or something and your neck is jacked up in the morning, that thing, that's helps
for
me.
what we do like that, like jiu-jitsu, wrestlers, MMA, like we put our head like in bad spots all the time, and that could happen, especially for someone who already had the fusion, and then like I've been doing that like more and more through the years, but sometimes you don't do it, and then you start feeling again, and
the concern for people who have had a fusion is the disc above and the disc below the fusion, because now these two discs are working overtime.
Stretching it too much, you mean?
Just more wear and tear on the discs, because all of our necks wear out, especially in the lower cervical spine. But now that you have a fused segment, what our concern is that disc above and below that segment, especially below, wearing out even faster. So that's where we use daily traction as a preventative, just to keep everything nice and limber. And when you pull the spine apart like that, the discs actually take in more water, more cerebrospinal fluid. It's called imbibition, like to imbibe, to drink.
That's good, right?
Yeah. So we're pulling that disc apart and basically stretching it, right? Like doing yoga for the disc, kind of like you were saying. That makes a lot of sense what you said. And getting that disc to imbibe and drink up more fluid and try to plump that disc up as best you can.
Does it start doing it more and more? It's like, oh shit, it's time to suck up some juice.
Well, kind of like a sponge, right? Like if you put the sponge in some water, it'll slowly suck up some juice. But if you move it around a little bit,
and if it's always compressed, it's not sucking.
Right.
The sponge isn't sucking shit.
So basically, we want to keep the rest of the neck healthy. And when you start to have an injury, whether it's you're just having some symptoms, or if it's like post-surgical, like in Tanquinho's case. Now's the time to start being nicer to your neck, obviously. Yeah.
And the funny thing is, after my surgery, the whole treatment, let's say that was 2011, 2012, that when I did the therapy. From there, I just conquered and win my biggest titles in jiu-jitsu.
Mm-hmm.
So that's why I won like the awards like 4 times as a black belt. And then won the no-gi awards like last year, the ADCC, and then I started to do MMA after that. So that was funny because remember the story, the doctor told me, oh, you're not going to be training anymore. Yeah. Mm-hmm. And I was like, wow, what are you going to do? And then seeing the treatment that Dr. Kobe gave to me and that works and giving me hope again.
More confidence.
Exactly, confident for sure. And still able to do what I was trying to do my whole life, you know what I mean, competing on that level and winning the biggest tournaments in jiu-jitsu. So it was something that make me really proud,
you're doing it better.
Sure. Exactly. I think everybody needs to go through a fusion surgery. No, just kidding.
Elective fusion surgery.
No, just kidding. But maybe for me, it was something that I need to pass and help me to be a better athlete, to be more professional. You know what I mean? Take care of my body a little bit better too, and I don't regret now.
So, is there anything you do daily now, like neck exercises, to keep your neck moving right and strong?
I do some body weight, moving my head,
mm-hmm.
Lying down, move my head, but not daily.
Mm-hmm.
But because normally sometimes you're training, you're playing guard in your body, sometimes you hold your neck, so you're already getting your neck tired. And especially for MMA, you training boxing, so you do a lot of head movements. Mm-hmm. So I think that's all helps, the muscle part. But what I always do is stretching. That's
mm-hmm.
something that I try to do before every practice, stretching my neck, all the direction that I can. Especially if I start to feel that I start to get tense and then
mm-hmm.
tight. I try to stretch pretty much every day,
Mm-hmm. There's a little bit of evidence, from in the world of research showing that strengthening your neck can prevent neck injuries.
Is that the halo thing or whatever?
Yeah, there's that. There's just neck strengthening in general. It's one of those things that's hard to prove. It's hard to prove that stabilizing your neck and shoulder blades is going to be good for a disc herniation specifically, but it passes the common sense test. So we're talking about things you can do like traction and soft tissue work and strengthening. It's one of those things that's hard to establish exactly what everyone needs. So what you try to do is take the exercises that have been proven to help or be the most likely to help. And with a person with discogenic symptoms, maybe they know they've had MRI and they know they have a disc issue, maybe they don't, but chin retractions are very simple. And you often meet people who have been a disc patient for more than a year, and no one's ever tried neck retractions on them just to see if it makes them feel better or worse. And neck retractions are easy. Sometimes people call them chicken necks or chin tucks, but you just try to sit or stand with good posture. I like to really get shoulders back like this, and you just do neck slides back like this.
That looks cool.
Right. And it seems like if you were somebody with pain down your arm and a disc diagnosis, that that's too simple. That's not going to make your symptoms better, but you see it time and again where someone comes in who's really hurting like that. No one's ever tried that with them. There's a ton of clinical evidence showing it's helpful, and you try that and their symptoms temporarily get better. But it sort of proves with that person that some neck stabilization is going to be good. But sometimes when you're really hurting, you can't really do this stuff.
Sounds like chiro bullshit to me.
Right.
But.
So lots of times it starts with passive care, like getting someone feeling better and then getting them active. But getting them active, the goal is to help stabilize that area. It might not fix the disc issue, but help stabilize the neck in general.
Well, and like be careful. It's your neck.
Yeah.
Well, like surgery should be the last step, right? Like you all need to try to do all those things first.
Right. In your case, it was a little
Yeah.
bit more of an
Yeah,
emergency,
yeah.
but yeah, lots of times with chronic issues, the biggest mistake we see wrestlers and fighters make with neck problems, which are often disc issues, is they tough it out for way too long.
Well, like orthopedic surgeons, you said this to me a long time ago that for every orthopedic or for every hammer they see a nail, it's like, oh, let's just cut it open and fix it that way.
Yeah,
Before
that can be
stretching
part of the
it
problem
out,
too.
or-
Yeah, that can be.
And
part
you
of the
get
problem.
told by a doctor, like, I'm just going to listen because he has a
Mhm.
stethoscope around his neck.
Well, sometimes, like, one thing about disc issues in the neck and the back is that there's not a lot of great clinical correlation between what you see on MRI and what the patient's feeling. Because you could have a patient with a ton of discogenic type symptoms, and you get that MRI report, and they've got a little disc bulge, right?
Meaning
And then-
they're a pussy.
Right. Or no, just their symptoms are bad. And then I've seen patients who their MRI shows a big disc herniation bulging into the nerve and compressing the nerve. You can see it right on the MRI. And they have a little tingling in their fingertip. So it varies a lot. So it's easy to see how when someone gets an MRI, the surgeon or the specialist might look at a bad disc bulge on MRI and be like, this thing needs to go now. But the patient's presentation isn't really all that bad.
Yeah.
So let's see.
In my case, mine was really bad.
Yes.
I was in a lot of pain.
Yeah.
So before it was just like your neck was just jacked, like you couldn't even.
No, like I couldn't move, but like I had like a sharp pain on my shoulder blade, like almost like a knife.
Like all the time when you moved
like,
your head?
Yeah. No, not moving my head, just sitting. The only way that I was not feeling it was if I put my right arm up like that. I was walking the street like that.
No shit.
Or lying down. When I was lying down, I was not feeling it too. Beside that was like
Like it feels like it needs to be cracked, kind of like, or like it needs to be something.
No, like I feel like it was someone like putting a knife like on my shoulder blade, and the whole time like just every time like just going a little bit more.
And how long did you go around like that? Where it was?
Well, like
before?
for 10 days. The day that I heard, I heard it one day. Probably like 2 or 3 days after that, that's when I started to have those symptoms. So one more week until the surgery,
Wow.
So, Professor, you're still with ACB, right?
Well, actually, my contract just expired today now in May, so
Okay.
I'm technically a
Oh, you're free agent.
Free agent.
So what are you thinking? What do you think is on the horizon? Is there any particular matches that you'd be excited about, or particular tournaments you're looking forward to?
Well, I was looking forward to do some MMA fight. That's my goal right now. Maybe 1 or 2 fights on the year. I don't know if I'm gonna be able, just because the whole scenario, the whole pandemic and stuff. For the next year, I might defend my title on the ADCC because I'm the champion. That's every 2 years. But I'm trying to push them to do like a super fight instead of do the tournament again. Just because I want something bigger, right? Like I'm already like 37 years old, and I mean, go there and win one more time the tournament. It's not gonna add in too much to my legacy. Like if they create something new, like a super fight, like a lightweight open or something like that, that is gonna add in something for my legacy, for what I'm gonna show. I would excite me to go there and compete,
Yeah. So that way you could match up with particular people that you want to have a match with.
Yeah.
As opposed to.
Well, like I gave the suggestion to put me and the other guy, the division that was 170. So I was the 145 champion. So I said, well, like put it with me, the 145 champion, and then the next division, the 170 champion, to fight it for the first lightweight open.
Wow.
Right. And that guy is a JT Torres. He won the last 2 ADCCs, but we faced each other 5 times before, and I won 3, I lost 2. The 3 that I won, 2 were no-gi. So the 2 times that we fought no-gi, I beat him before. 170, So Well, I think I can do it again for sure. But like I said, I want something bigger, something that is gonna be open space for the lightweights competing, because now just I have the regular open, and you know what I mean. Like for the 145 guys, 170 guys, normally we don't go compete in the open, just because we need to fight our division before, and for the good ones who made to the finals, like that's literally like 30 minutes before starting the open, and you also need to make your weight every day, so you're gonna be like small. So creating a lightweight open would just create like a chance for everyone on those divisions to fighting like in an open, and of course make more money, like get like a more attention, and I think it would be fair for me and for him to be the first ones competing there, and so that's I'm trying to push the promoters to do that from ADCC.
You gotta start doing some Henry Cejudo stuff, cringe factor stuff.
Yeah, well, I might do it, but I'm not good at that. I might need to Henry and learn a little bit of that. But I mean, like, I'm trying to do that. That's what I want to do the next year. And of course, hopefully we have the events all around the world back, and I can do some MMA fights again. And I'm not now fighting at 35. I'm going to fight 45.
Right.
I'm not that 35 anymore.
We were talking on the podcast earlier this week. We were talking about weight cutting, and it's nice to think it's nice to know you don't have to do it, because it's a whole nother battle.
Yeah.
You know,
well,
beforehand.
we still dieting, still losing weight, but it's not like for me. I walk around like 6'5". Sometimes I get in 170. That's my normal weight. You know what I mean? If I'm really in shape, I get like 60, like good, and then like. Going to 45, I'm still doing to diet like good 15 pounds. It's not bad, but like to 35, that's a different road, you know.
Yeah. Your biggest cut ever was 20-something pounds, right?
Well, I did 20. Well, I didn't make weight, but
Right.
I was supposed to be 27 in 4 days, so I lost 21.
Right.
I didn't. I just gave it like 6 over. It was I ordered for the weigh-ins. I was not losing any more weight. I said, wow.
Spitting into a cup all day.
I was doing everything, you know what I mean? It was 6 pounds. If it was a little bit less, like, I would keep trying, but, like, was like, I was literally like 2 orders without losing, like 0.0, 0.1, 0.2. And then the wins was on the next order. And I said, man, like, I'm not losing 6 pounds in 1 order, no. I'm just stopping right now. I'm going to lose the same 20%. You know what I mean? So it's not... But I took a short notice, you know what I mean? 5 days to fight, 4 days to make weight. I was 27 over. Well, so... Right.
When I trim just a few pounds for a jiu-jitsu tournament, like a few days, like I feel it. Like I'll get dizzy. You know? And we're talking about like 7-8 pounds.
I get hangry too. You know, burritos start looking good, and it's like, whew.
Professor, is there anything else you can think of that we should cover, you know, either related to neck injuries and jiu-jitsu, or anything else you'd like to talk about before we start to wind things down a little?
Well, I think just people need to have the conscience, you know what I mean, to listen your body and you know what I mean, understand what's happening to you, and for sure, like, starting to do like the preventions, like you said, the stretching, then maybe the decompression a little bit every day, especially the fighters, competitors that... Like we said, we put our head in so many spots there, like on the ground, on the hips of someone. So that's good happening. So I think it's important, because you're never expecting to happen with you until it happen, you know. So that was me. I never had any problem. I was just going 100% all the time, and like posting my head, fighting for every single point. And then one day that's happened to me, and then I passed through all that situation. So maybe if I was a little bit more careful before, I would no need to pass for everything, you know. So maybe good tip to everyone, just looking for your future, you know. When you're younger, nobody think about that. But when you start to get older, things happen, right?
A common theme, too, is just the education of the fighter and themselves, because you'll get a lot of doctors, coaches telling you you can do this when you know you can't, or when you can do something.
That's the evolution, too, you know what I mean? Like, the sport being involved in so much that you need to be professional. So you need to look to every aspect, you know what I mean? One
thing that comes up on the podcast time and time again is you can be a fighter, you can be tough and aggressive, but you that doesn't mean you're excluded from being careful, you know, and listening to your body.
Even sleep is a training, you know what I mean? You need to take your rest and sleep well, eating well, like do the therapy that you need to do, preventions. So yeah.
All right, that'll do it for today. I'd like to give a big thanks to Professor Tanquinho. If you're here in Tempe, Arizona, and you want to train jiu-jitsu, I mean, why not train with the best teacher on earth at Soul Fighters here in Tempe and in the West Valley of Phoenix too. Also like to thank our sponsors, Dark Horse Lionheart and 48 Real Estate, the Beard Estate agents. All right, we will talk to you next time. Bye.